Okay, are we recording? Okay, welcome everyone to the podcast. Today we're joined by Dr. Christopher Adrian Johnston.
Oh, doctor, you could just call me Christopher Adrian Johnston.
All right, Christopher Adrian Johnston.
It's the full name.
He is the founder and modern visionary of DUA, which is a very ambitious, amazing startup biotech company with a mission to cure cancer. But first, coffee for Dr. Johnston.
Thank you. Yeah, I slept like 3 hours last night, so
Oh no.
it is what it is. This is my first cup. You might have to bring me out 7 more. I love coffee. I actually have a list.
Oh,
of
you do?
rankings
Do share,
for
please.
coffee. It stays in this room, okay?
Okay.
My list actually has Baltimore as my number 1, but there is a coffee shop in New Orleans.
New
That's
Orleans.
a close second. It almost went number 1.
Got
The
you.
reason it didn't go number 1 is because I'm really close with the person in Baltimore. But he can't know this.
He
Matt,
can't know.
Black Acres, amazing coffee in Baltimore.
Black Acres.
Yeah,
we
but
don't
New
know
Orleans
that
came
anyone.
second.
He didn't tell us here.
New Orleans came a close second.
So New Orleans, what were you doing in New Orleans?
It's actually when I went to a conference
Okay.
to speak about one of my inventions, but really the real reason was I was entering another field, something therapeutic, and I wanted to figure out what the field was doing at that point. So, I decided to kind of get the inside scoop of what people in the field were doing. But I was actually there for a different invention. I mean, I love inventions. Yes, we're all researchers, but I don't think we should think of ourselves as that. I think we should think of ourselves as inventors at the end of the day.
So your invention journey, to my understanding, started when you invested 5 years into your PhD.
Yeah, 5
and
years.
then you
long
went
years.
Very long.
Long years.
We were in
You
it
know.
together.
You know.
We
5
made it
long
through.
years.
But you're the one that decided to dive head on into starting your company. No break. So it's pretty intense.
Yeah.
So, after my PhD, I was really burnt out. And now I want to know what inspires you, what keeps you motivated, what's keeping you going?
I mean, look, for me, what pushes me is this thought that we are inventors. And what actually makes an inventor? It's their creativity, right? And if you think of creativity, you think of art. I actually had, in undergrad, I went to College Park, by the way, the University of Maryland. I had a professor senior year who said, "You guys aren't scientists, you guys are artists." And that actually meant a lot. But when you think about it deeper, artists are also known as artists because of their creativity, right? Music actually is the art that heals you emotionally, mentally. Film does the same thing. Medicine heals you those ways as well, but also heals you physically. And I feel like all art heals. So I like to say that we're artists, and I think that drives us to be creative and design forward in everything we do.
So for you, you mentioned music plays a big role in your inspiration. Why don't you drop some artists? Who are you listening to? Who's inspiring you?
Oh, I love music, so I love that question. I'll say my favorite artists of all time are the Beatles.
Okay.
But I'm listening to a bunch of different things. I love Taylor. I love Drake. I love Beethoven, Mozart, Puccini. I love opera.
I remember we were studying in our first year of our PhD, and you pulled up some Mozart and you were jamming while solving our thermodynamic problems. I'm like,
it's actually
he's
funny.
on a vibe.
But yeah, music's played a big part of, in my life. I remember when we were young, my dad used to blast Bob Marley a lot, like every weekend. So I love Bob Marley music as well.
So your dad,
Yeah.
I know throughout our friendship, you have trusted me and a lot of your other friends to be very vulnerable in your story about your dad and how much of a cornerstone he has been in your personal and professional career. So tell us a little bit more about that. I'm curious.
Yeah. So in high school, I lost my dad to cancer. It's tough to talk about it still. I obviously miss him. A lot of pivotal points in my life, I wish he was there. But that actually spurred me on this journey. I remember I was very upset after. And actually, for me, I was kind of angry with God, I feel like, at that time.
Okay.
after high school, went to Rutgers, couldn't focus, went to a few other schools, couldn't focus. And I know everyone's path is different, but for my path, I became closer to Christianity, God. That helped me to fill a void in my life, I felt like, that left. Went back to school, Montgomery College, UMD, all the way to Hopkins. And I feel like I actually had to prove a lot of people wrong.
Oh, yeah?
I had to prove a lot of people wrong. But, you know, it is what it is. I feel like it grew me a lot.
Yeah, so how did that happen? So you started when you were in Montgomery College and UMD. What did you study? And did you keep that same path going into Hopkins?
Yeah, chemical engineering. I knew I wanted to do something therapeutic.
Okay.
So I figured I could learn that kind of on my own through research and reading. But I wanted to start a company to actually push this forward to be as quick and efficient as possible, obviously.
We love efficiency as engineers. Yes, ma'am.
So I thought of engineering, chemical engineering, to learn more about the process of scaling up and manufacturing, optimization. So did chemical engineering, but did cancer research, all the way to starting DUA. Yeah, the name for DUA actually was an ode to my dad. He's from Ghana. I remember looking a lot at names of other companies, and a lot of them have Latin and Greek influences, and I said, screw that. How about do something for my people?
Yeah.
And look into my own roots. So my dad's Ghanaian, where he's from, Cape Coast. The language is Fanti, and the word Dua there actually means tree. So to me, I looked at it like, new life, growth. So I went with Dua. I like the name. It also has a nice ring to it, right?
I like it.
It's short.
It's short, it's
modern,
sweet. You can throw it in anywhere. Like when people, I hope now, once your company launches, instead of thinking Dua Lipa, they'll be like, oh, Dua, the cancer therapeutic.
I love Dua Lipa, though.
Okay,
so
maybe not outshadow her, but like other Duas. I think there's also a Dua coffee shop.
There is a Dua coffee shop. I actually didn't try it.
Oh, you haven't tried it yet?
It's not one of the ones that's on the list.
Yeah, I don't know if it'll be on the list. We'll both try it out sometime later.
We'll see.
So let's get into the science. Tell us more about the foundation of Dua and like how you got all these ideas for the company.
Yeah, Dua, basically we have a motto that we regenerate immunity. During my time at Hopkins, during PhD, I always wanted to do something therapeutic, even though I got advice, don't worry about that. Just do a project, get out of here, in a good time.
Oh, that's interesting. Yeah,
and then do something therapeutic after, right? Yeah, we all heard that. Like, just do something now and then leave. But, I got very bored and annoyed with my project, so I said, screw that, I'm going to do something therapeutic. So I thought of a big problem in cell therapy, regenerative medicine, which is actually getting it to work for solid cancers. And one of the big reasons is that these therapies can't get your immune cell to get inside a tumor.
And this jungle, we're also assuming it's like very dense, very complex, very hard to navigate. And so these immune cells just cannot get in there.
Exactly.
Okay.
But I remember way back in undergrad, even from Montgomery College, even before I transferred to College Park, doing a lot of reading on my own, realizing how the immune system's our body's medicine, right? It's our own healer, right? And we all actually get cancer multiple times in life. That's crazy.
Really?
I was shocked.
I did not know that. For real?
I was shocked, and I was like, wait, what?
Oh my gosh.
Right? Because, cancer is just the misregulation of cells, right?
Okay.
So we actually all get cancer multiple times in our lives, and it's our immune system that's able to locate these cancerous cells and eliminate them before they become the full-blown disease.
Sure.
So the immune system has that ability to keep us from being diagnosed with cancer, right? Curing us silently multiple times in our lives without us even knowing it. So we wanted to give back all of the cancer patients' ability for their immune system to be able to do that again, right? Locate cancer cells and cure the patient again. So we looked at how these immune cells migrate, discovered some cool things. And I remember just being at home and doing a bunch of drawings and trying to figure out how to make my project more therapeutic, and designing these proteins that actually we call movement proteins, velocity proteins, to get your immune system to be able to navigate the tumor's jungle again. We give it back its map.
That is so
back
cool.
its navigation system.
What
its
I love
GPS.
about it is it stems from such a very simple mechanism, and I think a lot of therapeutics, people start very complex and they go off the rails, they go down rabbit holes. But you realize that in the universe, like, the simplest solutions are always like the most effective solutions.
I think the simplest solutions are the hardest to think of, right?
They are, because people love to make things more complicated than they are. I want to delve a little bit deeper into the biotech industry. I know, as just someone with a fresh PhD trying to get into the private industry, that it's lucrative, it is competitive, especially on a small scale startup basis. It's, you know, you're afraid going in every day whether the company is going to survive or not. So now that you're entering this, how do you navigate that?
I mean, okay, personally, I had to get over a lot of things myself. I actually had spent time on a lot of grad panels, as you have too, you know, speaking to people to give advice, right?
Yeah.
And I think that actually forces us to think about the things that actually shaped us and pushed us forward. For me, I had to get over a few humps about myself entering this field, you know. I mean, this field, let's face it, right, is dominantly white-oriented.
Yeah.
And, you know, we all have something to contribute. And I think coming into this field wanting to kind of play nice, to be accepted.
And it's hard, because you go in, you feel like, I feel like I have to be accepted to get anywhere. But they already have an idea of who they already want to accept.
Yeah.
So,
And
how did you...
Look, I've been fortunate enough to cross paths with a bunch of people who have not, you know, looked at it that way and accepted me for who I am, you included, right? But I would say early on, entering even undergrad, you know, even the way I dressed, I felt like I was cosplaying to, you know...
Cosplaying?
To, in a way, look a certain way, to not be offensive.
Is that why you
someone.
Showed up on the first day of class in a button-up?
I will say, I love my nice shirts, I love my ties, but yeah, I do feel like, you know, a lot of it was, it was just trying to do everything to, you know, not get looked at as someone that they're not going to give opportunity to. And this is, I think, where I started to change, having things repeatedly happen. In one of my physics labs for our final project, it was me and my partner on the project. We both did the final project, obviously. We turned it in, and the professor came up to us, and she said, "Wow, great work, guys." And then she looked at him, and she said, "I know you did all the work." And I was like, what the hell?
No.
Yeah.
Really? And you were there?
I was there.
Wow.
I was sitting right there, and I was just stunned.
That is so disappointing. That's ridiculous.
I think things like that happen again and again when people look down on you, even when I was, you know, cosplaying to be accepted, right? And still not being accepted. It's like you play by rules and people still don't, you know, the arbiters of those rules don't let you win when you deserve to win. So I think a lot of that just made me kind of say, well, screw it. I'm going to be myself. And I think that's good. I think a lot of people, you know, when you're on a path, you know, that's innovative, it's digging into yourself and being yourself, because we all want everyone's individuality, right? That's what the world wants. We're all individuals for a reason. I want your individuality. I want to know what you bring to the world, and we need that. And what I bring, we need that. What someone else brings, we need that. So it's that individuality that everyone brings. I think just being yourself, digging into yourself, seeing what that is. Unfiltered.
I love that. Honestly, especially coming from a place of academia and training and mentorship, just seeing the rhetoric that your professor had and just seeing that being perpetuated is absolutely disgusting.
Yeah, it was tough, but
and you've been proving them wrong. Whether you dress in your nice, newly ironed button-ups and your tie, or whether, you wear whatever you want. Like, Dr. Christopher Adrian Johnston is Dr. Christopher Adrian Johnston.
Yeah. I feel like we don't want to go through these things
No, we don't.
before. But looking back, it's like, we're glad they happened, right? Like, we're both so much more mature. Like, when we went in, we were really naive. We were naive.
Just too innocent, very vulnerable. But I think going through these challenges, both of us, I do see we have matured significantly. And I think we are both, I don't want to toot our own horn, but like, from the feedback I've been getting, we're both really good mentors for people who look like us, who come from the same background as us,
Yeah.
Like, coming from backgrounds and then of like low income, or coming from backgrounds of color, first generation.
There we go.
And now we're doctors from Johns Hopkins.
It's crazy.
Very
to
impressive.
say.
And you're the one going to start his own company.
It's crazy to say.
And so, doing all of this stuff, there are no simple feats, right? And actually, I believe you are the only one in our cohort, our doctoral cohort, who is going off to start his own company and has gotten so far. I know you're really putting yourself out there. And of course, all of us are behind you, hyping you on. And this is a friend asking a friend. How did you, overcome those feelings of, I don't know, imposter syndrome, or like these misconstrued conceptions that people have of you? Like, how did you get through that?
I feel like we all have crazy ideas, crazy thoughts, we can call it, but if we don't take a leap, those thoughts, those ideas, they stay in our heads. And if we take that leap, we put ourselves out there and say, screw if we make a mistake, screw if it's not the right idea, and just take that leap. I don't see anything negative that can come from it, especially when you have people around you. I have all of you guys that I could always fall back on, that I can look to for advice, for strength, my family, more friends, and just know that, you always have people there. You have all of us, everyone, we all have each other, and you have people who will guide you through the way. So you don't have to do it alone, but take that leap and just see.
Yeah, but I agree. Having people around you to kind of believe in you and encourage you to take that step is really, really important.
Oh, yeah.
All right. Well, with that, I'm wondering, with everything that you're doing, do you have some sort of legacy that you want to leave behind?
Okay, we talked about the science at DUA, but I think what makes a company great is not just the work they do, right? The work they do kind of is the foundation. It solidifies you for the reason of having this company. But I feel like every great company has a mission that's important to them. And it's that global mission about how is this going to make the world better, or how is this company pushing the boundaries to make the world better, right? Obviously, we could say, right, with medicine, yes, we're fighting to cure cancer. But what sets us apart, I think we're pioneering what we see as the future. And I think this is going to be the future. I don't think things can stay the way they are. And this future is where everyone is seen as smart, is capable. If they're smart and capable, right? Doesn't matter your interests, the music you like, your style, what you like to wear. If you're smart, you're smart, and everything will be accessible for those who want to innovate and create. And that's what I see as the future. When everyone is involved, we don't lose out on brilliance and creativity from big sections of our population. We're inventors, right? All of us. We're artists. We should run our companies, and that brings more people into the fray, and more people out of the fray into the field, and you have now more competition, less monopolies, and you make it simple for the public to pay attention and to actually engage, then we start fighting for them. That's how prices get down. That's how access grows, right? Having everyone contribute and not being gate-kept and giving opportunity to everyone. That's the future, and that's the legacy that we want to leave.
That's an amazing legacy.
That's the legacy we want to leave.
That's an amazing legacy. I hope you're able to see it.
I
hope we're able to see it in our lifetime.
We will. So we'll fight. Like, what I like to say to the rest of the team at Do It is that we'll be the last ones fighting, so that the next generation doesn't have to fight.
Yeah.
We'll be the last ones fighting. So we'll win the fight. We'll win the fight.
Absolutely.